This is a video about the unblocking of central venous access devices. A partial occlusion is when the access device can be flushed, but a blood sample cannot be aspirated. A complete occlusion is when the access device cannot be flushed and no blood sample can be aspirated. The approach to these two types of occlusion is different because with a complete occlusion, you first need to determine how many mils of fluid you can actually flush into the block port. Please pay special attention here as we need to prepare the urokinase for the procedure and we need to avoid an error. If you are not sure, please check with someone. The steps to prepare urokinase for partial occlusion is as follows. Urokinase comes in powder form in a vial of 60,000 units. You dilute this to 12 mils of normal saline by injecting that amount into the powder vial. The next step is to withdraw 1 mil of that fluid, which is 5,000 units of urokinase. Based on the access device that you are trying to unblock, you then dilute the 5,000 units to the required volume. For a port, it is 5 mils, for a PICC 1 mil, and for a CVC line 3 mils. Preparation of urokinase for a complete occlusion is different. You once again take the 60,000 units of urokinase in powder form, but instead of 12 mils, you dilute this to 6 mils, which makes it more concentrated. You then withdraw 0.5 mil of saline, which is 5,000 units of urokinase. You then take the 5,000 units of urokinase and dilute it to the required volume, the volume of which will be determined during the procedure, which we will demonstrate. Ultimately, in both a complete or partial blockage, the idea is to instill 5,000 units of urokinase per attempt at unblocking. Important safety reminders. If at any point in time you are unsure, please check with someone before proceeding. Do not use excessive force when unblocking, and do not use a syringe smaller than 10 mils, as when you do so, the pressure can be very high and you can cause a rupture of the tubing. After a vial of urokinase powder is reconstituted, it can be used up to 60 minutes for other catheter unblocking attempts. If a new attempt is required after 60 minutes, a new vial of urokinase has to be used. We will go through an attempt to unblock a partial occlusion in more detail first. These are the materials required for unblocking of a partial occlusion. These materials are shown here. A reminder, a partial blockage is where the line can be flushed, but good blood return cannot be achieved. Prepare the required amount of urokinase as what we have just discussed, which is essentially 5,000 units of urokinase diluted to the correct volume. Clean the needleless connector at least 10 times. Check for blood return yourself to make sure that this is a partial blockage. As what you see here, what you should find for a partial blockage is that you cannot achieve good blood return. At this point, administer the urokinase. Leave 1 mil and lock. Clean the needleless connector. Wrap the needleless connector with a gauze and afterwards apply a tape. On the tape, indicate that the unblocking is in progress. Check back again 45 minutes to an hour later. So now you come back to the same patient after a break. Perform your hand hygiene and put on a clean pair of gloves. Proceed to remove the tape and the gauze. Clean the needleless connector at least 10 times. Now check for blood draw using a 10 ml syringe. If there is blood return, draw at least 5 ml and discard. Flush the line with 20 ml of normal saline. Clamp at the last 1 ml. Hep lock with heparin saline 50 units. Stop at the last 1 ml and lock. Clean the needleless connector and you are done. In the event that unblocking fails, attempt to draw and discard the amount of urokinase that was instilled for unblocking. You may then repeat the unblocking attempt with another 5,000 units of urokinase. In general, for unblocking, do not attempt more than 10,000 units of urokinase per lumen. We will now go through the steps for complete occlusion. These are the requisite items required. These items are shown here. In a complete blockage, you cannot flush the line and you will not be able to aspirate any blood. You will need to prepare the urokinase beforehand, as we have discussed. The first step is to attach a 3-way stopcock, and based on the procedure that we will now demonstrate, you will now determine how many mils of fluid can be instilled into the obstructed lumen. Clean the needleless connector with a no-touch technique as demonstrated. Again, clean the line upwards towards the clamp. Place a clean drape underneath. Remove the needleless connector and clean the end of the tubing. Attach the 3-way stopcock. What you should end up with is a 3-way stopcock with 2 syringes attached. At the red arrow, we have an empty syringe. And at the blue arrow, we have a syringe filled with a small amount of normal saline. Make sure that the clamp is unclamped. And now with the empty syringe, we create a vacuum. As circled in red, please make sure that as you're doing this, the 3-way stopcock is set to open with regard to the empty syringe. Pull the plunger until resistance is felt, and whilst maintaining the vacuum, turn the 3-way stopcock such that it is open with regard to the normal saline syringe. Take note of the amount of normal saline that goes into the lumen. This is the amount that can be instilled. This is the amount of fluid that you should now make up the volume for your urokinase. The next few steps now involves resetting so that we can instill the urokinase proper, again using the vacuum method. With the three-way stopcock still in an open position with regard to the normal saline syringe, disconnect the empty syringe full of air and expel the air. Reconnect it. Turn the three-way stopcock such that it is now in a closed position with regard to the normal saline syringe. Now, replace the normal saline syringe with the syringe with urokinase. Again, we repeat the vacuum method. Pull the plunger until resistance is felt. Turn the three-way stopcock such that it is open to the urokinase syringe, and the urokinase should enter into the block lumen. Remove the empty syringe and replace it with a cap. Now we wrap the whole line with a sterile drape. We apply a tape and a dressing and wait for 45 to 60 minutes for the unblocking to take effect. We now come back to the same patient to check the results of the unblocking. We clean the three-way stopcock as required. Before removing the syringe, we clamp the line. We remove the syringe and proceed to clean the area. We then attach an empty syringe to check for blood return. If we can see blood return, aspirate at least 5 ml and discard. Now we clamp the line and remove the whole three-way stopcock. We attach a new needleless connector that is primed with normal saline and proceed to flush. We need at least 20 ml of normal saline. Stop at the last 1 ml and clamp. We now proceed to hep lock with 50 units of heparin saline. Clean the needleless connector and we are done. In the event that unblocking is unsuccessful, you can repeat as per what we had discussed for partial occlusion. This is the end of the video. Thank you.